For 10 years, C2H has been a part of countless stories of resilience and hope. This is Jalil's.
Hi, my name is Jalil Toussaint, and I want to share how one organization changed my life forever. For years, I would brush off how I felt as far as like my health went. A lot of pain, a lot of fatigue, just a lot of lack of energy. And usually I just would tie that to me getting older, just not having the same youth as I used to have, which is normal. But there was this one day where I really felt like something was off, but I just really didn't know where to start. I didn't know who to ask. I didn't really know what to ask.
The path to a diagnosis can be isolating, but no one should have to walk it alone.
And so one day I spoke to my pastor, Dr. Charles A. Moody, and within 2 minutes of the conversation, he says, "Hey, you need to talk to Elder Greer, Miss Mia Greer."
So when he came to me, he said, hey, I'm having these symptoms, and he told me a little bit of his background, and I told him, I said, you know what, you need to see a doctor. It sounds like you have something going on with your kidneys. And he said, well, I've been trying to see a doctor, but it's taking so long, and I'm feeling so bad. And he was at a point where he was really down, and he didn't know what else to do. And I have a friend who happens to be a nephrologist.
And she tells me, well, here at C2H, we have some partners, and one of those partners happens to be Dr. Tesanovic.
Kidney disease is what we call a silent disease, so usually there are no symptoms until it's way too late. And when someone who's young gets sick or is diagnosed with a chronic condition like kidney disease, it's hard. It is something that's devastating. You imagine, what that's like if he were to start dialysis, or if they start dialysis, their whole life changes. It's a real curveball.
That connection empowered Jalil to move from being a patient to becoming a proactive advocate for his own health.
Comes to find out that this FSGS, it wasn't genetic, but it has gotten to a point to where I will need a kidney transplant.
So she took Jalil, and she found out that he really had kidney disease, and that he was near renal failure, and that he needed help right now. So she sent him to a specialist. And because of our connections, we were able to figure out what was wrong with Jalil. He needed to have a kidney replaced, and now he is being prepped and ready for a kidney transplant.
The blessing in all of that is that, instead of me telling the story out of, fear, confusion, or even desperation, because that I'm, connected to this community, I actually have a kidney donor.
Being able to work with people who otherwise, if we didn't catch it early, it might have had a different outcome for him. So it's meaningful for me as a physician when I can really help someone have a different outcome.
It just brings me joy to know that because of C2H, that we have somebody that is getting a kidney transplant, not on the list, but getting one, has a donor, and he will live the rest of his life like a young man should.
I gotta say that I didn't think that that would be possible for me. So many stories, of situations like this, but because I am connected to this community, and because I am connected to C2H, I have access to life.